So for those practices that are already familiar with Eclipse and the diabetes module, you should find that using the COVID-19 module is quite easy and similar to navigate around. The main priority is looking at the lists. You have a list with priority patients, which populates with those that have had the government letters. Ours now populates with those that we've contacted by ourselves, either with a letter or by a telephone call.
So to go through the columns, the contacted by HM government letter are those that actually receive the shielding letter. We've populated our contacted by COVID Protect letter with patients that we have contacted either by phone, by letter, and by text in some circumstances. And the contacted by phone are only populated by those patients that have completed the online survey that's in the Eclipse module as well. And we do have a couple on there that are uncontacted but have since been contacted, and the list will be updated shortly.
So this group, additional patients for third wave letters, was a group that we originally didn't have when we started using Eclipse. And these were the letters that were sent out at the end of April. We had already contacted most of these through one way or another, and we expect to find that when we get the fourth and fifth wave letters, which are due to be, the information's due to be uploaded over the next week from NHS Digital, that our figures will change and we'll need to review those. As an example, if you click on this bit here, it brings up your patients. It does take a while to load, and you come up with a list of these people. Those that have got red COVID Protect ticks in or received letters from the government are highlighted here. How we chose to use our list was to prioritise the highest, and just by clicking you can change the ascending, descending lists completely. You can do the same with losing those that have had a letter or not a letter. So we've only got one outstanding. To find the information, if you are on the secure N3 connection, if you click on this part, it comes up with your patient, or you can click on what they call a Smurf review, which tells you why they are on the list completely. This, if you click on their WHO score, tells you that this lady has got cardiovascular disease. She is picked up in the pregnancy list as well, so sometimes you do get that overlap between patients. Lots of other information that's pulled through from System 1 regarding patient, blood tests, clinical conditions, the card, so worsening angina tells you all about the different things that they've had. One of the ways that you can contact patients, which is where going back to this page, contacted by telephone, is because on her Smurf review, if you start the initial survey complete now and go through the questions that are on there, that picks up and is what the contact by telephone information is about. So quite easy, simple questions to fill in. So once the initial survey has been completed, if you choose to use that one, you can then give patients their unique COVID reference number, which is this number down here. Completely different to the patient reference number, which is System 1 related. So they have this number, they can self-complete a daily questionnaire. As a practice, we've decided not to ask them to complete it every day because it would generate lots and lots of messages coming into the surgery on a daily basis, but to ask them to complete it if and when they have got problems. When these are completed, they come back in under this box, the patient survey, and we've just done a few trial patients. So there's been 3 patients who have had the patient questionnaire survey completed by telephone, and then they have completed the patient survey on the NHS website and they need to input their unique COVID reference number along with their date of birth, and the questions are very similar to the survey. If they flag up any queries, somebody from the admin team can just have a look at this daily or twice daily If it's healthcare, they can pass it to the relevant GP. If it's medication, it can be passed through to the meds management team. If it's something to do with shopping, food parcels, everything, anything that's social that you would pass to social services, our social prescriber will deal with those requests appropriately and give them the information. And then this bit, the alerts passed to the GP, probably won't be used by us because we're dealing with this in-house in the practice rather than outside of the practice. So once you have got your list of patients, of everybody that you need to contact, and this is a nice easy list to look at because we've only got one patient to contact, you can export it across to a spreadsheet, and you can either have patient data on it, which was the export COVID patient, which comes up with patient information. For this exercise, I am just going to use the export patient just to try and maintain a bit more patient confidentiality. So once you've exported your patient list, you can enable editing, you can get rid of columns, you can minimise it, print it out, and as you can see, this list has got, nobody's had the vulnerable letter from the government, but we've sent out 56 letters or contacted 56 patients about COVID Protect as to whether the shield or the need to be self-isolating. So we've only got one patient. This patient reference number corresponds with the system 1 out of your PAT list, which somebody from the admin team will sort out. This is the patient's unique reference number, and that's the number they need to be able to log on to the NHS website that they're given to look at, to fill in the daily questionnaire. The other list that you can look at, which to protect patient data, is if you click on this one, it comes up and shows you the patient's demographics. So you could, in theory, print the list out of the patients who haven't been contacted and just give that list to a member of the admin team and get them to ring and run through the COVID questionnaire to see whether they actually need any help, and then they can be flagged up to the relevant clinician or admin person within the team. So as a practice, Megan and I, when we started off with this list, we didn't have sufficient data, so we had to review our patients and go through, and some of the problems we found were transplant patients, we didn't have any issue with group 1, no problems. Cancers, we didn't find any problems there. So particularly with group 3, severe respiratory disorders, we looked at our patients quite closely because the government guidance letter that went out just said severe COPD. What is severe COPD? After lots of research, we found that we had a lot of patients in this group that were on triple therapy with mild COPD. British Lung Foundation has a lot of information, and we've included that in the links at the end of the different societies and links we've used. Rare diseases, we didn't find any that shouldn't have been in there. It's worthwhile looking at your immunosuppression therapies, especially the rheumatology and dermatology ones. There is clear guidance available on who should be on there, because a lot of patients we just sent the letter and saying they needed to shield, and we now know that patients who are only on one immunosuppressed medication and are well controlled don't need to shield, they just need to do the strict social distancing. Our pregnant with heart disease, our figure shows 6 on the screen. We actually only have 2 that have got heart disease and pregnant and should be shielding. The other 4 have got some reference to heart disease that's been recorded through baby scans, and it's the baby that's the problem, not the actual pregnant lady. So it's worthwhile just reviewing, and it's quite a small number. Running through the other lists, category B are quite very similar. The patients are ones that are in the top group, and as another guide, these figures all don't add up because some people are in more than one group. You can be in the high risk group with severe COPD, in the high risk group with severe asthma. An error that we found was patients with cystic fibrosis. The read codes that they are using are one of the read codes on System 1 that used to be used for DVTs. So we haven't got 16 patients with cystic fibrosis, and we're waiting for this information to be redone once we've done upload today. The other problem we found was high-risk patients with sickle cell. This picks up codes of patients who have got the sickle cell trait or are sickle cell carriers, or it's documented in the notes that the partner is a sickle cell carrier. It's worthwhile looking at the Sickle Cell Society for their information, but these group of patients do not need to shield if there are carriers or traits. Patients on immunosuppressants, you'll find people are in there more than once. As I mentioned earlier, this group, pregnant with heart disease, we had 6 patients and we know we haven't got those. 4 had been contacted by the government, 1 by us, 1 uncontacted. In the bottom of the category B group patients, there's only 2 patients in there, which we know that figure is correct. 1 has been contacted, 1 we've just been informed that she's pregnant, so we need to contact her. But she may very well get a letter through the 4th or 5th wave that information hasn't been passed over. Over to Megan.
So in terms of the category C patients, these were vastly the patients that we'd contacted that had received a letter that were incorrectly placed on the high government shielding list. Vastly the amount of discussions we had with this were in regards to discussing whether they are extremely vulnerable or if they are just at high risk, which the difference is quite significant when actually explaining it to the patients. A lot of patients didn't understand that being extremely vulnerable meant they had to shield, whereas at high risk there was strict social distancing. So just coming down to the bottom, you can see here that the WHO scores are all broken down into categories. As you can see, the numbers just regress the lower the scores are. We made it a priority that anyone with a WHO score of over 11, they were all contacted by a clinician or our social prescriber to ensure their well-being, and we try to do this for the rest of the groups as well, but made these our priority, and it's just a list of further broken down, but you can also do this by clicking on any of the other lists and breaking it down into their WHO scores. So it's important just to note when discussing the WHO scores that although they may have a low WHO score, doesn't necessarily mean they are not extremely vulnerable. So it is important to check every patient. However, on the opposite side of that, there's very few that have a high WHO score that aren't extremely vulnerable.
So as an example, this patient has only got a WHO score of 1.9 because she's got cardiovascular disease. She's only 27. She's one of our pregnant ladies. Just looking at that WHO score on its own, you would think that she would be a lower risk, but because of her cardiovascular disease, she needs to be shielding, and she has been informed accordingly. On the other side of the Smurf reviews, a high WHO risk, and this patient should be shielding because of his comorbidities. Interestingly, the renal failure one, it's worthwhile checking what their EGFR is, because the lower the EGFR is, the more likely they are to be shielding. But as said previously, not every patient who has a high WHO score needs to be shielding. Some of them just need to do strict social distancing. So just as a recap, it is worthwhile remembering that people are using shielding, isolation as interchangeable terms. One of the issues that we had was trying to get patients to understand there is a difference between shielding or being advised to self-isolate or maintain social distancing at their discretion.
So thank you all for watching. If you want any further information, and the resources that we used can be found on the Ipswich and East Suffolk CCG website under the COVID-19 page and under Eclipse down here. There's also a video in there by Dr. Julian Brown, who did an earlier version of an Eclipse video to help as well.